Hey everyone, in this video, we're going to talk about breathing at rest, respiratory frequency, and volume. Let's get into it. Okay, Andrew, let's get started with respiratory frequency on this one. So what should one see at rest in terms of respiratory frequency?
There's a good range, and it does depend a little bit on age factors and lung volume factors. But typically, we see respiration rates or respiratory frequencies in the range of 6 to 12 at rest.
Now, let's talk about a little bit further into the frequency. If we see something that's either much lower than that range or much higher than that range, what can it indicate to us?
Yeah, so high respiratory frequencies do sort of push towards some sort of stress response. So there is usually an indication or a reason that a patient or an athlete is breathing fast, and it's either has to do with challenges of the lungs, so the lungs aren't exchanging air the way they should, and we see that in people with COPD or asthma. So medical conditions that cause poor airflow or poor exchange across the lung surfaces. And then we also see it obviously in medical conditions like anxiety and hyper alert responses to things. So fear response are typically things. So we do see that quite often in the medical setting because patients are anxious about being where they are, either in a hospital setting or in a doctor's office. If we're noticing that in a rested person, then it does raise the concerns that there should probably be further investigations, or at least a discussion about why the person has defaulted to a faster breathing pattern. They may or may not be aware of that. And they may or not be in tune with the anxiety that they're feeling inside or other concerns that they might have if they were aware of their breathing patterns. The slow breathing patterns is probably less of an issue, especially if you've read any of the recent literature or the book, a very popular book called The Oxygen Advantage by Patrick McEwen. Talks about the benefits of slow breathing. And again, in most circumstances, slow breathing is beneficial. It has some physiologic benefits. The primary one is not an oxygen shift, but it's actually a carbon dioxide shift. So slower breathing raises carbon dioxide levels in the blood. That helps vasodilate peripheral systems. It increases blood flow. It increases oxygenation to the tissues because of the changes that the carbon dioxide does to the body physiologically. There's benefits to the heart. There's benefits to the brain with elevated CO2 levels within a set range. So slower breathing by control is not a bad thing. There are, again, some medical conditions that have reduced breathing volumes, and there's some neurologic conditions and some central apnea issues where people have an underlying condition that does not trigger a normal breath response. Again, fairly rare, but worth looking into it. If the person's not consciously controlling their breathing down to a slow level, and it potentially could lead to lower oxygen levels because they're not breathing enough. Certainly that would be a concern that'd be worth looking into further. But in most circumstances, the slow breathers are actually quite fit individuals who've done some respiratory training and have some better control of their respiratory status. Yeah,
that's what I was going to say. You're probably more likely to see some very low frequencies on somebody who's well trained and maybe even knows how to control their respiratory system quite well. If we talk about volumes now, so we talked about frequency. Volume is another really important parameter in breathing and at rest as well. So what tidal volumes can we expect to see in someone at rest? And I'm also going to pull up a little graphic here so we can illustrate that, but go ahead.
Yeah, so it's great the way you've done that is the tidal volumes and the respiratory frequency together combined to form the physiologic parameter of ventilation. So similar to a heart rate and a stroke volume, respiratory frequency and tidal volumes multiplied together equal the ventilation, which we typically report in liters per minute. So from this graph, you can see this sort of a sinusoidal wave is a typical breathing pattern in a relaxed person. And the 0 to 6,000 milliliters or 0 to 6 liters is a typical volume for an average sized male. Now, remember, we talked in previous thing about spirometry and the fact that lung volumes and lung sizes are quite closely related to height of an athlete. So the taller you are, the larger the lung volumes we expect to see. And there are normative values and data available to compare your lung volumes to the average people of the same height as you. But what you can see from this graph is that typically when people are resting, they use about 500 mils per breath in the middle range of their lung volumes. That's that 2400 to 2900 value. That means that the part of the lung that goes from the around 3 liters to up to, in this athlete, up to 6 liters is not typically used at rest. They use the middle lung volumes. They have some volume below that, so they could blow out more air if they wanted to, and they could inhale more air if they needed to or wanted to, but they typically use a middle range of about 500 mils per breath on average. Some people slightly bigger, some people slightly smaller, depending on how rested they are and how stimulated they are to actually take those breaths.
I have a quick question for you before we go further. Why do we see that in the middle range and not in the low range? It makes sense that it's not at the top of the range, because we know, without going too far into it, we know that at essentially when your lungs are full, there's a lot of pressure to try and empty the lung. So it wouldn't make sense to be completely full. But then why? Because it would be advantageous from a volume standpoint to be at the very bottom of that range. So essentially oscillating between almost fully empty and just having that 500 milliliters of air. Why does it actually reside in the middle of that range in a resting person?
It's a great question. It's a great question. It has to do with a couple of different factors. It has to do with pressures. And there's a static pressure within the lungs. The lungs are very similar to a sponge, a soft sponge that you can squeeze water out of and you can release it. And so to blow all the air out means you actually have to squeeze the lungs, and you have to squeeze it using intercostal muscles. The diaphragm is actually when it's fully exhaled, is actually in a relaxed position. So you have to fully relax the diaphragm, and you have to squeeze the rib cage down smaller. And there's an elastic recoil of the rib cage up to a mid-range thing. So we actually have to contract muscles to get air out. And that's not a relaxed position. So the relaxed position of the rib cage and the lungs, it falls in that middle range.
So you have, on one side you have the like you said, the recoil of the lung, and then you have the pressure of when you're trying to the recoil of the rib cage, and on the other side you have the pressure game of trying to fill up your lungs fully, and hence the middle range that it ends up being into.
Exactly.
Okay, very interesting. And so because you referred back to spirometry, so vital capacity on this image here is what we would actually quantify through spirometry, correct? We would not be able to see the residual volume. That's maybe something that's more interesting on the clinical side. But for us, if we can actually see all the volume that they can access through that spirometry, that gives us the range or the amplitude or the volume, and then we can kind of look at this. So going a little bit farther, you talked about 500 mils per breath, more or less at rest. What should we think about if we're seeing much higher volumes than this at rest, and then or much lower volumes than that? And I guess it makes sense to talk about those in relationship to frequency as well, because they're inextricably tied, if I can get that word out.
Yeah, you're totally right. So if they're taking larger lung volumes than that, and they're breathing very slow, then that is an expected response. If you slow your breathing down, typically you're going to take slightly larger or bigger volumes with each breath to maintain your oxygen levels and your carbon dioxide levels in that range that was most comfortable. So I wouldn't worry about larger lung volumes if they're associated with slower respiratory frequencies. If, however, they're breathing fast, 10 to 12 breaths a minute or higher, and breathing deep, then there is some other there's something else driving that. And I would, again, start looking into some of the medical causes for hypermetabolic syndromes and things like that. So hyperthyroidism can cause that kind of breathing pattern, CO2 retention from other issues, acid-base disorders and things can force people. Typically, when you see that pattern, people are unwell. These are not athletes that are coming to you to look for improvements in their 10K running performance. They're people that are having some sort of respiratory assessment because they're feeling short of breath, or they're worried about something happening. And those people really should be referred on to the medical system to have further investigations as to what the causes are. I would suspect that these people stand out. They stand out as unhealthy, and they stand out that there's something wrong. It's not something you would pick up on a test that isn't fairly obvious as they walk through the door, that they're already looking short of breath, or they're looking like they're air hungry. Yeah.
If we talk about now the other end of the spectrum, very, very low tidal volumes, how should we look at that?
Yeah. Again, if they're tolerating low volumes and not responding with super high respiratory frequency, so again, they're quite often linked together. If they're breathing small volumes and breathing very fast, then there is some education that can go along to help balance that out, to give them a little bit better volumes and slow down their breathing. If they're breathing low volumes and it's not causing them any dramatic effect on their respiratory frequency, they may just be that they have learned to tolerate higher CO2 levels. And this may or may not be an issue. If it's not affecting their performance and their daily living, then it's not necessarily a problem. It may be some of those people have actually trained to do that. I imagine, I haven't seen it, studies at rest in our deep sea divers, or the people that are doing prolonged breath holds, but they have trained their bodies to tolerate super high CO2 levels. So I would suspect at rest, they typically would have a relatively low respiratory frequency and probably not super big tidal volumes. And just because they've learned to tolerate that. So again, it would depend a little bit on the circumstances. Is there other reasons for them to have developed CO2 tolerance? The typical group, the most common group that have high CO2 tolerance, not from training, are smokers. So they tolerate high CO2 levels. They're outside a normal range, which most people would drive them to breathe faster and deeper. And those people miss those signals. And so I wouldn't be surprised if seeing low respiratory frequencies and low tidal volumes in smokers because they're tolerating higher CO2 levels.
That's really, really interesting, Andrew. Thanks for answering those questions. So for people watching the video, make sure you drop us a little like. If you have any follow-up questions, put them in the comments, and stay tuned for the next video.